Well, good afternoon. I'm David Stockwell, the Medical Center Director here at VA Northern California. And I just want to take a few moments and talk with staff about the new access standards that were just released in connection with the VA Mission Act that was passed last summer. This is the act that replaces the Choice Act for VA. And the access standards are the new rules that are replacing the choice rules of 30 days and 40 miles as far as distance or time to available appointment. And so the VA's published the new proposed access standards this week. And there's some pretty remarkable things in the new proposal. They include that every veteran will be eligible for urgent care visits in the community, meaning non-emergent but unscheduled. So if you have strep throat or to get your flu shot, where you can go to a network-approved urgent care without pre-authorization. For veterans without a copay, the first 3 times a year that they go to urgent care, they will not be charged anything for those visits. For veterans that already pay a copay, they'd have that same matching copay in the community. And then for all veterans, regardless of eligibility, $30 per visit to urgent care after those 3. So that's an entirely new benefit that hasn't been available to veterans. It wasn't part of the Choice Act because it didn't cover unplanned or urgent care in the community. It was never part of the mill bill or emergency care plans that the VA had in the past, but it's going to exist, and that benefit will start June 6th of 2019. In addition, the new VA Mission Act talks about 30-minute drive time, average drive time, and that any veteran that's more than 30-minute average drive time, as determined as average drive time by the VA, will be eligible to get their primary care, mental health care in the community under VA authorization rather than being required to come to the VA to receive those services. For specialty care, it's a 60-minute drive time circle. And so you can think about the impact on our healthcare system with these change in rules. Thinking that we can send a patient from Redding to Martinez, or from Redding to Sacramento, or even from Chico to Redding to access specialty care. Is that a 60-minute drive time, or is it more than that? And we won't be permitted to require a veteran to travel more than 60 minutes for access to their specialty care from an average drive time perspective. This is going to foundationally change how we deliver care to veterans. Many hear these standards and they think, oh no, all the veterans will leave and go to the private sector for their care. There won't be any veterans left coming to the VA. It doesn't make veterans go to the private sector, it allows veterans to go to the private sector. And so if we continue to provide high quality, compassionate, customer service oriented care to our veterans that's superior from a timing perspective, from a quality perspective, from a continuity perspective for our patients, they're going to continue to choose to use the VA. Some patients won't. And they'll get their care in the private sector, but many will. I just wanted to take a few moments to make sure that our employee community was aware of these changes that are coming our way. They're big changes. There'll be lots of questions about eligibility and drive time and wait times. By the way, the 30-day wait time also disappears. It's now a 20-day wait time for primary care and mental health and a 28-day wait time for specialty care, with some exceptions. And so those are the proposed access standards. We're still trying to get our arms around them. I sent an email out to staff to explain some of this this week, but I thought I'll just take a few minutes on the video blog to share the information as well. So I know that's a lot of info. I don't want to overwhelm folks, but I want to make sure we're informed. So let's have a great day. Let's continue to serve veterans. And let's remember, the competition has risen a little bit as far as veterans' ability to choose to use the VA or not. So it's our job to make sure we're meeting their needs in a high quality, compassionate way. Thanks.